Senate President Ahmed Lawan and Speaker Femi Bajabiamila were in the State House to compare notes with President Muhammadu Buhari on various issues regarding the fight against COVID-19 in the country. This is a follow-up to the series of engagements the leadership of the National Assembly had with the Presidential Task Force on COVID-19, ministers and other stakeholders coordinating efforts at tackling the global pandemic and providing succor to the nation's poor and most vulnerable. Speaking to newsmen after the closed-door meeting, Senate President Ahmed Lawan said addressing possible challenges to be confronted by Nigeria post-COVID-19 were also discussed.
This time, what is upmost to us is to ensure that Nigerians get succor, get relief, and we will do everything possible to ensure that there is equity, there is fairness, there is justice in the distribution of any support, whether it is a relief package or indeed any support in terms of fighting COVID-19 in the states of the Federation. The President has taken the right decision by approving an additional 1 million families to be included in this social register, and I believe that in the next few weeks the Nigerian people will see a difference in the implementation fully and properly, efficiently and prudently.
Speaker Femi Bajabiamila, on his part, said the engagement with the President is a further demonstration of their commitment towards maintaining synergy in addressing issues relating to the welfare, well-being and security of Nigerians.
The broadcast yesterday was worked well. There were added incentives. What is imperative right now is that when you ask people to stay at home, you must make that home a little bit more comfortable for them. Make sure the light is constant for those 2 months. It's a stimulus. Give it to people free of charge for 2 months so that they'll be able to stay at home more conveniently. It may be a tough sell, but where there's a will, there's a way.
The Minister of Humanitarian Affairs, Disaster Management and Social Development, Sadia Umar Farouk, who also met the President, gives an insight into the presidential approval for the capture of additional 1 million households in the social register.
We are going to focus more now on the urban poor. These are people who depend on the informal sector to earn their livelihood, their daily wage earners. And these are the people that we are really going to focus more on, as well as people living with disabilities.
The minister announced plans to hand over the distribution of food items as palliatives for the poor and the most vulnerable to the state governments.
Coronavirus has been in existence really for quite some time, but the novel COVID-19 came into existence December 2019, and it took the world by storm because it started from Wuhan, and from Wuhan in China it has spread all over the world. There's hardly any country where it has not reached. Some people are still speculating, but the fact is that it is a reality which we must all face. As far as Nigeria is concerned, the first case came early late in February. We haven't been dealing with the case. The first case came from Italy, and of course the Italian one came from China. Since that first case, I want to praise the government of the day for the actions and the presidential task force that has been inaugurated to deal with this. There have been a lot of contact tracing, and many people have been diagnosed. A lot of people have evaded testing and screening, and some of these are going to come up, and that is the reason why the present program by the federal government that of total lockdown, so that in those areas we have many cases, particularly Lagos and FCT or Ogun, all these places need to lock down so that the contact tracing can be more effective and the spread will be reduced, because the virus itself doesn't move, it moves with people. And when people move it, it spreads. And therefore, we need to cooperate with the government in order to reduce the spread and curb the scourge of it. Individually, there are a lot of things that we need to do concerning our hygiene and also our social life pattern. The social distancing that has been preached is very important. We should reduce contact, physical and socially. We should increase the level of our hygiene because our hands are the most important instruments of conveying this virus. The virus has been found to be airborne. Initially, it was thought to be by droplets, but now it's been confirmed to be airborne, and that is the reason why anywhere we go, we need to be wearing our masks, so that we protect ourselves, we protect the people all around us to reduce the level of infection. And what has been preached concerning when people are coughing, that you don't just cough into the air, we need to maintain some etiquette. Either you cough into a tissue, or you use your elbow to shield your mouth and nose from spreading the virus. And also the use of hand sanitizer, because these droplets fall everywhere. Anywhere we touch, we don't know how much virus has been spread on it. So we need, when we wash our hands regularly, or when there's no water, you use hand sanitizer. These are alcohol-based chemicals that help to kill the virus wherever they are. And then every surface around us, we need to be cleaning it regularly with these disinfectants. We also need to show ourselves up whenever there is an illness. If we feel ill and we know we are being in contact with any of these sources, people who have traveled abroad, or people who have treated this kind of cases or have been treated with this kind of cases, we need to report ourselves so that the disease is, as it's coming up, it is treated early, we go into isolation and reduce the level of spread. And I know with this, by the grace of God, we'll be able to curb the spread and bring it under control. The federal government is doing a lot as of now, and we are importing. There's a lot of importation of medical supplies and equipment in order to treat those people who have contacted the disease. And I know in a very short while, if we cooperate with the federal government and its policies and programs, we shall bring it under control. And the outcome of it is that the economic effect of this disease and lockdown will not be prolonged, and we shall quickly come out of it successfully. There are not many myths that are surrounding the coronavirus right now. Drinking alcohol, bathing with saline water, salt water, and all sorts. I think we should desist. Even some people going into taking chloroquine as a